What's up, TUMNAD lectures? In this video, we are going to be taking a look on what we call the cardiac cycle. If you find this video helpful at the end of it all, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now in this video, we are going to be taking a look on what we call the cardiac cycle using one of the most beautiful kind of the diagrammatic illustration that was invented by one of the great American physiologists called the Carl John Wiggers. How John Wiggers came up with this beautiful kind of diagrammatic illustration, which is going to be also helping us in mastering the different events that are going to be happening within what we call the cardiac cycle. So now what you're seeing here is a diagram of what we call the Wiggers diagram, showing the different events happening in what we call the cardiac cycle. Now in his kind of the diagram, his main emphasis was to be monitoring changes in the following kind of what we call the parameters. We are going to be mainly focusing on what we call the aortic pressures, okay? And of course, this black line is going to be representing what we call the aortic pressures. Then when you look at this blue line here is going to be representing what we call the arterial pressure, okay? Then when you come over on this red line here, which is going to be moving all along like this one here, this one is going to be telling us the different changes in what we call the ventricular pressures, okay? And then when you come here, this green line here, which is moving like this one here, is going to be telling us what's going to be the ventricular volume changes during different kind of the phases, okay? And then the last one is this kind of the red line here, which is telling us the electrical activities, or what we call the electrical conduction system of the heart. It gives us different kind of the waves depending on different type of what we call or the mechanical events going to be happening. And then even also there's another kind of the small kind of the device which we call the phonocardiogram that's going to be giving us a hint on the different kind of the heart sounds which are going to be generated, because we have multiple different kind of the heart sounds. We have S1, S2, S3, S4, but the most important kind of the sounds are going to be the S1 and then the S2, which are mostly heard by everyone during clinical examination. The lab-dub kind of the sounds, which is S1 and then the S2, okay? Now that we have seen what we call the orientation of what these lines are going to be telling us, and of course on this side you're going to be having what we call the pressure changes, as we have said for those lines, and even also what we call the volume changes, as are going to be denoted by this green line instead of the ventricular volumes. Okay. Something which is so much beautiful is that whenever you see these lines here, this one which are going to be measuring what we call pressures, whenever you see them crossing one another, at that point, we are going to be mainly having a look at the status of what we call of the semiulnar valve, or even also what we call the AV valve. Okay, so now we are going to be paying much attention whenever these lines are coming across one another. Okay, that signifies there's going to be a change in what we call the status of what we call the valves. Okay, now that we have had that kind of bit of what we call the orientation, let's go ahead and get started and look at the explanation of the diagrammatic illustration. Okay, now we are starting from this phase. We said that the cardiac cycle is going to be having approximately around 4 phases depending on the source of the information, but of course there are some other authors that are giving multiple different kind of the phases, but me, I categorize all the phases as 4 phases of the cardiac cycle. We said that we have what we call mid to late ventricular diastole, which was the first phase. Then we said that the second phase was what we call isovolumetric contraction, okay? And then the third one was what we call mid to late ventricular contraction, and then the last one was what we call isovolumetric ventricular relaxation, okay? Now, when you look on this diagram here, we are seeing that our first phase is going to be what we call the arterial systole. Now, where is arterial systole going to be coming from? Now, you realize that during the late phases of what we call ventricular diastole, that is when you're going to be having the SA node firing to depolarize the entire arterial myocardium to cause it to contract. It is going to be happening towards the late ends of ventricular diastole. That's why this arterial systole is going to be enclosed in the other phase, which we said as a mid to late ventricular diastole. Okay, you should have that concept in mind. Okay. Now, we have said that during arterial systole, now, before arterial systole, we're going to be seeing now blood is going to be coming to what we call to the atria. We're going to be having blood from what we call the pulmonary vein, that's from the pulmonary circulation. Also going to be having what we call blood from the systemic veins, are all going to be coming into what we call the atria. And of course, the pressure there is going to be increasing. And of course, we said that as the pressure in the atria increases more than the pressures within the ventricles, we said that the AV valves are going to be opening. And when the AV valves opens, we're going to be having passive flow of blood down to the ventricles without any kind of the contraction. And we said contraction is going to be coming towards the end of what you call ventricular diastole. That's why you're going to be having the SN node firing to depolarize what you call the atriomyocardium. Okay. Now that we have seen what's going to be happening within the arterial systole, but at this point, what you should know is that the pressures within the atria is still greater than the pressures within the ventricles. And for that's why you're going to be having our AV valves being open to allow the movement of the blood into the ventricles, increasing this kind of the ventricular form. Okay? So now when that kind of the phase is done, we are moving to another kind of the phase. Now, what is that phase? Now, you are seeing here that the arterial pressure is now going to be decreasing. Now, it is going to be decreasing, and then the ventricular pressure is now going to be becoming higher than what we call the arterial pressure. Now, in our mind, what does this one tell us? It means that the ventricles are starting to depolarize and then to contract. Okay, that's what it's going to be telling us. That's why even you are seeing that on our ECG machine. Okay, we are going to be seeing this kind of what we call the QRS wave complex, because we had here the P wave, which was denoting what we call arterial depolarization and contraction. But because now we are seeing now the ventricles are contracting, that's why we are seeing what we call a QRS wave complex. Okay, meaning that we have what we call ventricular depolarization and eventually what we call contraction. Now, something which is so much beautiful is that here, as the ventricles are contracting, we are seeing a very rise in the pressures compared to what we call the atria. Before we go very far, there is this kind of the slight rise of the arterial pressure. You see this kind of the slight rise in the arterial pressure, sometimes denoted as the C wave. Now, this one, it is telling us that kind of the slight increase in the pressure as this kind of the AV valves are closing and they slightly protrude into what we call the right atrium and even also what we call the left atrium. So now, that kind of the protrusion of these AV valves as they close, that kind of the force which they exert in those kind of the chambers, they cause that slight kind of an increase in what we call the arterial pressure. It is also such another beautiful thing. Now that we are seeing now the pressure within the atria is decreasing, and now the pressures within the ventricles is becoming even more than the pressure within what we call the arterial, the right and then the left atria. What does this one mean? We said that where the lines are going to be crossing one another, we should pay much attention to what we call the status of the valves. Now, as the ventricular pressures becomes more than what we call the pressures within the atria, it will lead to the closure of what we call the AV valves. Okay, and the closure of the AV valves is going to be now giving us our beautiful kind of the heart sound, which we call the S1. That's why our phonocardiogram is going to be giving us here our heart sound, which we call the S1, which we denote as what we call the lap. Okay. Now, it means that here we are going to be having now the ventricles slowly depolarizing and then they're generating a lot of what we call of the pressures. That's why there's going to be an increase in what we call the pressures during this time. But it's something which is so much beautiful is that the pressures which is generated by the ventricular contraction is going to be still less than what we call the pressures within the arterial system, or even what we call the aortic pressure. What does one mean? It means that however much the pressure within this time, it means that the aortic valves at this time moment they are still closed. Meaning that this period we are seeing that the ventricles are contracting within a closed chamber. Nothing is going to be leaving the ventricles and nothing is going to be coming to the ventricles. And that's why when you see on the ventricular volume, you are seeing that it's going to be the same. Okay, nothing is leaving the ventricles, and that's what it's going to be. It's going to be the same. Now, as the ventricles contract and contract and contract and contract, time is going to be reaching whereby the ventricular pressure now exceeds what we call the aortic pressure. And this one takes us to another kind of the beautiful kind of the event, which we are calling the ejection phase. Okay, what's going to be happening within the ejection phase? Now, here we are seeing now the ventricular pressure is now exceeding what we call the aortic pressure. Now, we said that whenever you see these lines crossing one another, we should pay attention to what we call the valves. Now, you are seeing now here that the aortic valves are going to be opening. But at the back of your mind, you should also know that even also the pulmonary seminal valves are also going to be opening. Now, when they open, what's going to be happening? It means that blood is going to be ejected. That's why we are moving into an ejection phase of the cardiac cycle. And of course, as blood gets ejected off the ventricles, what's going to be happening on the volume of the blood within the ventricles? It has to decrease. That's why you're seeing that on the ventricular volume, blood, because it's going to be ejected, the volume is decreasing very much rapidly. Okay, and that one tells us that the ventricles are ejecting blood into what we call to the aorta. Okay, so now you are seeing that the aortic pressure is going to be still less and less and less and less. But of course, as the ventricles contract, time is going to reach whereby they're going to be reaching what we call peak depolarization potential, whereby they are now going to be starting to undergo into what we call a repolarization phase. Okay, they're going to start now relaxing, because they cannot contract forever. But now, when you come over here, you're seeing now that the ventricular pressure is now becoming less compared to what we call the aortic pressure. It means here we need to pay much attention again on what we call the status of different kind of the valves. Now, as the ventricular pressure drops, as the ventricles are now becoming into what we call the relaxation phase, the ventricular pressure is becoming less compared to what we call the aortic pressures. What's going to be happening on the aortic valve? The aortic valves are going to be closing. And when they close, we are going to be hearing another second beautiful kind of the heart sound, which we call the S2. So now here we are going to be hearing our S2, which we call the dub. Okay, as recorded by what we call the phocanodiogram. Okay, there is something which is so much beautiful here that we need to pay much attention. You are seeing there's going to be this kind of the brief increase, this kind of the sudden increase in aortic pressure. That one is so much beautiful, because at this time now the blood is now accumulating within what we call the aorta, and because the aorta is elastic, there's going to be that kind of the stretch. Okay, and of course this rapid increase in what we call the aortic pressure is what we call the dicrotic notch. It is such another beautiful thing. But of course, as now the blood is going to be now leading to the upper extremities and the lower extremities, the aortic pressure is going to be slightly decreasing. But however much is slightly decreasing, it is still going to be more than what you call the ventricular pressures, meaning that still what you call the aortic valves are going to be staying closed. Okay. Now, you are seeing that now here we are having now the ventricles are undergoing what we call a relaxation phase. The ventricular pressure is decreasing and decreasing and decreasing and decreasing. Now, during this time, it is so much special. However much the ventricles are still relaxing and the pressure is decreasing, but it is still greater than what we call the arterial pressure. Now, what does one mean in what we call the AV status? It means even at this time, the AV valves are still closed, because you are seeing that the ventricular pressure is still greater than what we call the arterial pressure, meaning that during this phase, which we are calling the isovolumetric relaxation, we are seeing that our AV valves are going to be still closed. Okay. Now we are seeing that as the ventricular pressure decreases and decreases and decreases and decreases, time is going to be reaching whereby they are going to be becoming now lower than what we call the arterial pressure. You see now the lines are now coming, they are crossing one another, and we say that whenever lines are crossing one another, we should pay much attention to what we call the status of the valves. Now, as the ventricular pressure now becomes less compared to what we call pressure, what do you expect to happen on the AV valves? The AV valves are going to be opening, and when the AV valves opens, this is going to be followed by what you call rapid passive ventricular filling. And that's why you're going to be having an extended extensive amount of an increase in what we call ventricular. But of course, when we are in isovolumetric ventricular relaxation, we saw that however much the ventricles were relaxing, there was nothing like blood that was leaving the ventricles, and there was nothing like blood that was coming into the ventricles from what we call the atria, because the pressure within the atria was still less compared to what we call the pressure within the ventricles. That's why within this isovolumetric relaxation, we are seeing that the ventricular blood volume was also remaining constant. But immediately after the ventricular volume becomes less than what we call the arterial pressure, AV valves are going to be opening, and now we enter into what we call rapid passive ventricular filling, and that's why you're seeing a massive increase in the ventricular volume, because now the AV valves are opening, and then there's an extensive amount of the blood coming into the ventricles. Okay, so now that briefly covers the cardiac cycle in line with what we call the Wiggers diagram. Thank you very much for sticking up with TUMNAD from the beginning up. And of course, I can't thank you enough for always watching my videos, always sharing my videos, always commenting down in the comment section. I can't thank you enough, but that's the only way you can promote TUMNAD lectures even to another level. Thank you very much for watching. As always, TUMNAD, until we meet next time.